Something for the Weekend
with Suzanne Kane
on Classic Hits 4FM.
Classic Hits 4FM, Saturday morning. Just wouldn't be the same without us, would it? Something for the weekend. Now, Suzanne was chatting to Annalouise Kenny during the week from the Fitzwilliam Private Clinic. She was chatting about a new system called Femilift. What's it all about?
Good morning, Annalouise. How are you?
I'm good, Suzanne. How are you?
Very, very good indeed. I'm very interested about what we're going to talk about for the next couple of minutes. Femilift.
Yes.
Something, I suppose, one of those things that a lot of women don't necessarily talk about, be it through childbirth or if they have any type of incontinence issues. It's not something we very openly talk about. But the good news is, at the Fitzwilliam Clinic, you can help.
Yes, we have a new non-invasive solution.
Okay.
Before now, there was always surgical option, but it just gave a lot of downtime. You know, there's a lot of uncomfortability with it. But with this treatment, it's non-invasive, it's pain-free, there's no downtime. There's nothing but benefit to it, and it makes it okay now for people to be coming in and getting treated further.
Okay, so what exactly is Femilift?
It's a non-surgical procedure for the treatment of vaginal laxity and urinary incontinence.
Okay.
What it does, it tightens up the muscles, the pelvic floor muscles, and stimulates collagen and elastin. So it helps with stress urinary incontinence. It's basically tightening the tissue that has loosened throughout, either after childbirth or age. It really depends, but it's a way of firming up and toning up your collagen and elastin again.
Because a lot of women will say, even through childbirth, that they do their pelvic floor exercises, but it just isn't enough.
Yeah, and it's also trying to remember to do those pelvic more.
When you're a new mum.
Yeah, exactly. You have enough to be worrying about rather than remembering to tighten your pelvic floor muscles. Yeah, and it's such a simple procedure because this only takes 30 minutes. It means you come in, you have the procedure done, and that's it. There's nothing more to it. So it's a lot easier than having to remember your pelvic floor muscles.
I definitely prefer this one. I'm going to have to ask you, Annalouise, because I know there's women listening this morning. Is it a painful... Now, I know we go through childbirth and everything else in between, but is it a painful procedure?
Absolutely not.
Okay.
Every customer we've had so far, it's pain-free and there's no downtime.
Okay, and then, so we just quickly, is there any side effects to this? Because as you said, it's a 30-minute procedure, virtually pain-free, nothing to it. But is there any side effects? Like, for instance, you go in 30 minutes, do you need to take a couple of days off work, or what's the follow-on from it, Annalouise?
With the minute after surgery you leave, no one would notice any different or would know there's no downtime. There's, obviously it's the same as if you had laser treatment done. It's just, no hot showers. But after that, you're done. You're finished. Nothing else to it.
Is there an age to this? Like, are you finding that in particular from an age onwards that women are really affected by this, Annalouise, or is it just depend on the woman, really?
It depends on if you've had children. That's one of the biggest one. Obviously, as we get older too, that's a very big thing. But we're also finding with younger women, women that are exercising or cough or sneeze, that they find they suffer from stress incontinence.
Okay.
And it's very in range from 28 up to 60, 70. It just really depends.
And again, and across age-wise, you're open to people going in and having a chat with you. So it doesn't matter if you're kind of in your mid-40s, mid-50s, mid-60s, you're open to go in and have a conversation with a consultant. Okay.
Exactly.
All right, that's fantastic. How do people get in touch with you guys to have a chat and to find out a little bit more?
Okay, the best thing to do is to come in for a free consultation.
Okay.
Our nurse will go through everything with anyone that has any questions or that's a bit nervous of it. So if you phone us on 01662 9908, or if you just want more information, you can look up www.fitzwilliamprivateclinic.ie.
Okay, fantastic. We'll put up all the details. Annalouise, thank you so much for taking time.
No problem.
We're talking to you this morning. I know there's women across the country will be frantically getting on. Listen, it's better than those pelvic floor exercises they tell you to do. I appreciate you taking the time. Take care. Have a great day.
Okay, thank you. Thanks.
Annalouise Kenny from the Fitzwilliam Private Clinic chatting to Suzanne all about Femilifts on Something for the Weekend. This is Classic Hits 4FM.